If your leg pain keeps coming back, it's not random, and it's not just bad posture. It's definitely not something you're supposed to live with every day. I'm Dr. Dustin Scott at the Connect Chiropractic here in Ames, Iowa. Sciatica pain is one of the most common things I see walk through my door. And it's not just the pain that get people angry, it's the cycle that doesn't seem to go away. It'll flare up, and then it'll calm down, and then it'll flare up again. You say, I don't know what I'm doing. I don't know why it's here. Of course, sciatica is not the diagnosis. It's just a symptom. The sciatic nerve is one of the largest nerves in the body. It runs all the way down from the lower lumbar spine at the L5, down into the hips, the glutes, the leg, and even the foot. The pain is reoccurring in the leg, but the problem is in the lower spine. And if we're not addressing that lower spine, then the symptoms just continue to return. There's 3 factors on why we address sciatica in the way that we do. The first is disc pressure. Every time you're sitting for longer than 20 minutes, that disc pressure is gonna push that herniation out onto the nerve root and out onto the sciatic nerve. That pressure on the sciatic nerve and sitting for too long will continue to increase the symptoms. You get up, you walk around, things are feeling better, but then you go back down to sit again. The problem's still there, living at that L5, that lumbar spine. And the next thing that can be causing your sciatica is, of course, your mobility. We're checking the mechanical stress on the joint, making sure all of the joints are mobilized and moving properly. That's when the adjustment comes into play and being able to make a high performance, precise adjustment to the correct joint, not just mobilizing everything. And the third factor is soft tissue damage. We have to address and diagnose the soft tissue damage that is starting to become worn out, weak, deteriorated, or even just scarred up from that sciatic nerve being irritated. That's why a good, higher value evaluation matters. Taking time to see how long and what the extent is of that pain. Let me tell you a story. A man, 40 years old, came in with sciatic nerve pain. As a mechanic for 35 years, unable to work without bending over and having sharp pain going down his leg every single day, draining his energy when he goes home and not able to be present with his wife, with his kids, or even get good sleep at night. After just a month of our care, he's able to get through a day of work again, get through a day without the sharp radiating pain. He's able to be present at home, enjoying time with the wife, with his kids, without the relentless pain. Feeling a lot more energy and ready to be himself again. We implemented spinal decompression to take pressure off of the lumbar spine and off of that lumbar disc. We then were able to utilize SoftWave and our soft tissue machine to break down the scar tissue and release the inflammation out of the hip and out of the leg. Finally, we were able to deliver precise, high performance adjustments because now we had pressure off the disc and inflammation out of the muscles. Within just a few weeks, he felt so much better. The pain disappeared from the leg, out of the hips, and then out of the low back. Sciatic pain was gone and his life had returned. And that's the goal, is we want life to be living at its fullest for you and for your family and everybody in the community. Here's a step-by-step approach on how we address the sciatic nerve pain here at the Connect Chiropractic. First, we've got to take a good picture. We got to see what the position and overall condition is of the spine. Next, of course, we got to do a very thorough evaluation to see what movement you have and you don't have. making sure that we address the exact tissues that have the exact problems. That's both through a movement assessment and also through a soft tissue assessment. You see, there's multiple angles and multiple facets that are going on within your life. After that, if we do see that within your history, we have a metabolic or a past chronic history pattern, we will address the metabolic, the weight, or the systemic inflammation that's happening in your life. From there, we'll put together a personalized, unique care plan with a certain amount of time that we believe you need, depending on your history, your findings, and what your evaluation had shown us, so that we don't guess and we make sure that the length of time that you're here is a guarantee that you're gonna get back the best life that you deserve. If during that evaluation we find that on x-ray and on the exam there is disc involvement and pressure on the x-ray, then you'll go through a series of spinal decompression therapy to help relieve the pressure off that disc and restore proper motion back into that joint. Along with receiving the axial decompression to take the load off of the joint, we're going to be mobilizing the joints with our adjustments. That helps not only put motion back into the joint, but it helps reteach and train the joints to move properly, just like they did when you were younger. If your sciatic nerve pain has been a chronic incident for over 5 years, and we find that on our chiropractic assessment, there is inflammation and scar tissue on that sciatic nerve living in the muscles and around the soft tissues, then we're going to be going through a series of visits on our soft tissue machine, on our SoftWave machine, to make sure that we are addressing the local inflammation on that sciatic nerve in the hips, so that we can break down the scar tissue, help repair and help regenerate the sciatic nerve for long-term health during your healing journey. Structure, motion, and inflammation. Those are the 3 pillars that matter when it comes to you getting back to 100% during your healing journey. Medication can help you short-term. It might help mask the symptoms. It'll mess with the brain to tell it it's not there anymore. But do you think it's doing something structurally? Do you think it's actually helping the structural problem? And the same is for steroid shots or injections. They don't have the best out for you long term. They might temporarily mask that site, but it's at the cost of ligamentous integrity and bone density. If the disc pressure remains on that sciatic nerve, that pain will continue to come back. That's why people feel better for a few weeks, and then it flares up again. The pressure was never corrected. Here are the signs that you need a proper spinal evaluation. Pain traveling down the leg, maybe even turning into knee pain, tingling in the foot, pain that's coming and going every week or every 2 weeks. It just doesn't seem to go away. Poor sleep, irritability, tightness in the hips that just doesn't seem to let go. Those are not minor issues. Those are signals from the brain telling you that your sciatic nerve is in trouble. Sciatic nerve relief is normal for many people. Once we remove the pressure off that disc that was inhibiting and painfully putting pressure onto that sciatic nerve. If you're living in Ames and you have recurring leg pain, recurring hip pain, sharp low back pain, call us at the Connect Chiropractic for your free spinal evaluation. We will evaluate exactly what's going on for you. You don't have to live in that cycle anymore. You don't have to keep going in and just getting the same crack over and over and over. Utilize the proper tools and get the proper care that you need to get your life back. When you come in, we first start with clarity, making sure that we know what the exact issue is specifically for you and be able to get down and dig deep and what tools and how long we're gonna have to address this to get you back to 100%.